Okay, in this lecture, we are going to discuss streptococcal infection. This bacteria, that is Streptococcus, having lot of different species, and the different species causes the different diseases in the human. We will see the most important species of the Streptococcus, and we will also see the different diseases caused by these different species. So let's get started. First of all, Streptococcus is a gram-positive bacteria that are actually present in the chain, like cocci are arranged in the chain form. Okay, so we have classified Streptococcus on the basis of the hemolysis. So beta hemolysis, alpha hemolysis, and the gamma hemolysis. Beta hemolysis, you will see the complete hemolysis. Hemolysis, you will see clear zone formation around the colonies will be beta hemolysis. In the alpha, you will see the partial hemolysis, and in gamma, you will see the no hemolysis will be seen around the colonies on the culture plates. So, in the beta hemolysis, you will see two most important species of the Streptococcus, that is Streptococcus pyogenes and Streptococcus agalacti. And in case of alpha, you will see the Streptococcus pneumoniae and the viridans group. And in the gamma, you will see the Enterococcus. This is the classification on the base of the hemolysis. And we have also classified according to the carbohydrate antigens present on their cell wall. So that is the A, B, D. A, you will see the Streptococcus pyogenes. B will be the agalacti, and the D will be the Enterococcus. And the two most important species further in the Enterococcus faecalis and the faecium. Next, we will see virulence factors present in these bacteria. So, first one is the M protein. M protein is specifically present in the Streptococcus pyogenes. This protein prevent this bacteria from the phagocytosis, that is actually done by our immune system. So, it will prevent this bacteria with the help of the M protein from our immune system. And streptolysin O, this is the thing that causes the hemolysis in these species. So streptolysin O, that is oxygen labile, and it causes the hemolysis in these species of the bacteria. And this is the streptolysin O, against which you will see the formations of the antibodies in the patient. If I say, if the Streptococcus pyogenes present in the body of the patient, then this bacteria having streptolysin O, against the streptolysin O, you will see the productions of the antibodies. So these antibodies are the ASO. So this is the important thing. So ASO actually causes two most important diseases that we will see in next session. That will be the glomerulonephritis and the rheumatic fever caused by ASO antibodies. And this streptolysin S will also be produced by these species. So this uh, streptolysin is actually the oxygen stable. So O will be oxygen labile and the S will be the oxygen labile. Okay. Next, we will see pyrogenic exotoxin. This exotoxin mostly cause the scarlet fever, in which you will see the three most important manifestations which you have to remember. First is the fever, second is the rash seen on the body, and you can see the strawberry tongue. So these are the three most important manifestations of the scarlet fever. Next, hyaluronic acid capsule, which is also prevent it from the phagocytosis, and immune system cannot detect the bacteria easily due to the presence of the hyaluronic acid capsules around the bacteria. Next, we will see what disease is caused by these different species. So first is the Streptococcus pyogenes. We have categorized, first is the suppurative, in which you will see the formation of the pus, and you can also see the toxin mediated, and you can also see the non-suppurative, in which you will never see the formations of the pus. So suppurative, you will see the pharyngitis, sore throat, In that case, fever, sore throat like symptoms will be seen in the pharyngitis, tonsillitis, inflammations of the tonsils. In that case, impetigo, you will see the golden yellow crust skin. In that case, you will see the skin condition. You can also see the cellulitis and the necrotizing fasciitis, that will be the flesh eating disease. This is the most dangerous one caused by the S5 genes. Toxin mediasis, that will be the scarlet as we have discussed. So in that case, you will see the fever, rash, and strawberry tongue. And non-suppurative, you will see the two most important diseases, that is uh, uh, that you will see after the throat infection. First, the patient having sore throat, and after the recovery, the patient can also go towards the two most important diseases, that will be the rheumatic fever and the glomerulonephritis. So these are the post streptococcal infection diseases. So pneumatic fever, you will see the three most important manifestation, because in that case antibodies will attack the three most important parts of your body. First one is the heart valve, second is the antibodies will attack on the joints, and third is the brain. So these are the three most important organs will be affected by the antibodies in the rheumatic fever. Next, glomerulonephritis, you will see the again antibody or antigen complex will deposit in the kidneys, and you will see the three most important manifestation. In that case, hematuria, blood in the urine. You can also see the edema, and you can also see the hypertension. So these are the manifestation related to the glomerulonephritis. Next is the viridans streptococci. You will see in that case, you will see dental caries, cavity formation done by this bacteria, and specifically Streptococcus mutans species. And it can also cause the infective endocarditis. Next is the enterococci. You will see the two most important species, fecalis and the facium. So it causes the UTI and the endocarditis, and it can also cause the sepsis. So these are the different species caused by these bacteria. Streptococcus pneumonia, the most important feature, it has a polysaccharide capsule that prevent it from the phagocytosis by our immune system. So pneumonia is actually caused by the S pneumoniae, and in that pneumonia you will see the rust color sputum production. You can this bacteria can also cause the meningitis and otitis media. Next is the epileptic transfer from the mother to the baby, and it causes the neonatal sepsis and pneumonia and meningitis. So pneumonia and meningitis will also be caused by the pneumonia, but it can also cause can be seen in the epileptic, but it is mostly seen in the newborn babies. And lab diagnosis, what sample we will take? So we can take the throat swab, we can take the blood sample, and we can take the pus. So these are the different samples for the culture. And in that case, if we will also go towards the gram staining, you will see the cocci in the chain, and hemolysis will also be seen around the colonies. In the beta hemolysis, you will see the S5 genes and S A galacti, and alpha hemolysis, you will see the Streptococcus pneumoniae. And S5 genes is actually bacitracin sensitive. This is the antibiotic. So we can differentiate the 5 genes and the A-galacti. So 5 gene is sensitive to the bacitracin. Next is the A-galactic CAM positive test will be positive, and the pneumonia optocin will be sensitive. So these are the different tests through which we can differentiate the different species like the 5 genes, A-galacti, and the pneumonia. ASO titer will also be seen, which will helpful in the diagnosis of the rheumatic fevers and the glomerulonephritis. And in the treatment, you can go towards the penicillin and the amoxicillin and the macrolides, but the important thing, the decision of the antibiotics will be done after the sensitivity test given by your laboratory. So this is all about the streptococcal infection. If you still have any questions, you may ask in the comment section. Thank you so much.